Hi, welcome to LangFort. It's me, Johnson, and today we are going to discuss a new case note. And in this case note, you are going to write a letter to patient's GP. So automatically, it's a non-case, and you need to select information accordingly. Please download the case note from the link given below and spare 5 minutes to read and understand it thoroughly before you continue watching the video. So in this case, Don, today's date is 22nd October 2022, and you are a charge nurse in the neurology department where the patient named Mrs. Caroline James was admitted following a stroke. So the patient details, name is Caroline James and age 43 years. When it comes to social history and medical history, you don't need to lose your precious time reading all that just because it's a non-case. So you can completely ignore the social history and medical history, and you can go straight to presenting complaints since the GP has no idea about patients presenting complaints. So presenting complaints on 16th October, patient was brought to ER by her husband due to deviation of angle of mouth to right, slurry speech, and the left upper limb weakness. So on physical examination, patient was generally conscious and alert. Vital signs were normal except BP, which was 120/60, that is diastolic hypertension, and CNS, GCS, E4, V5, M6, facial deviation right, dysarthria, our left upper limb, 3 out of 5, and left lower limb, 5 out of 5, and bilateral plantar flexor. Now, when it comes to diagnostic studies, MRI brain, right thalamic and internal capsule acute infarct. Routine blood investigations were normal and GRBS 99 milligram per deciliter. So, hospital course and nursing management. On 17th October, she was shifted to ICU where she was thrombolized with altiplex. She was also provided the whole antiplatelet, statin, PPI, neuroprotectives, and other protective measures. Then she underwent some other blood tests like APLA, protein C, protein S, homocysteine, in view of young stroke. And on the 19th, she was shifted from ICU to neurology ward where she developed UTI, for which she was provided antibiotics. Then she started to show signs of progress. Then on the 20th, her lab report came back positive for APLA and protein C deficiency, for which she was given warfarin for 5 days. So on 22nd October, she appeared clinically stable and said to be discharged. She was recommended to follow up with the GP thereafter. She was discharged on medications like Neutropil 80 mg 3 times daily, Strocit 500 mg twice daily, Ecosprin 150 mg once daily, Pantop 40 mg one in the morning, and Atorva 20 mg one at night. These are the medications which the patient needs to take after the discharge. Now the discharge plan. Observe for LOC, that is loss of consciousness, blurring of vision, facial deviation, slurred speech, limb weakness, and monitor for medication compliance. No driving or strenuous activities for 1 month, then review after 5 days in neurology OPD with the PT INR, URE, urine, culture, and sensitivity. This is the case note, and now the writing task is using the information given in the case notes. Write a letter to patient's GP, Dr. Jacques Bell, Parkville, 5C, Australia for follow-up care. So this is the case note. Now we need to write a perfect letter taking information according to the need of the patients for the care and keeping in mind that the patient is a non-case to the recipient. So now let's move on to the letter. When we start writing the letter, we should keep in mind the address part requires 4 points. That is, date of writing, address of the recipient, regarding or reference the patient's name and date of birth, and salutation of the recipient. So here, the date of writing is 22nd October 2022. Address of the recipient, Dr. Jacques Bell, General Practitioner, Parkville, 5C, Australia. Regarding Mrs. Caroline James, date of birth, 13th September 1979. Now saluting the recipient. Dear Dr. Bell, here you can place a comma. If you don't place comma, that also is perfectly fine. This is the address part. So just remember, when you write the address part, ensure that you have 4 points in the address part. Now coming to the introductory paragraph. When you write the introduction, we need to ensure that we have patient's full name, a main disease condition, and the purpose properly elucidated in the introduction. So when it comes to this particular patient, it's a known case, so we need to directly or indirectly mention that it is a known case in the introduction. So let's write it this way. Mrs. Caroline James, your patient, who is recuperating from acute right thalamic and internal capsule infarct, is being discharged today and follow-up care is required. So now let's come to the second paragraph. In the second paragraph, we need to write about patients presenting complaints, physical examination, and treatment provided. So let's start it this way. Mrs. James was brought to hospital on 16th October 2022 with a right-sided facial deviation, slurry speech, and left upper extremity weakness. Now, when it comes to physical examination or other investigations, I haven't mentioned them here just because it's a discharge summary and you are writing to patient's GP just for a follow-up care. And the GP has nothing to do with the patient's further assessment or treatment. In such case, if required, we can avoid the physical examination part. So the second paragraph, as I just read, now coming to the next line, we can write, following confirmation of the diagnosis, she was thrombolized with the altiplase and was commenced on dual antiplatelets, statin, PPI, neuroprotectives, and other protective measures. So now if we write all the information in the same paragraph, it is going to be a big paragraph. So I have decided to make another paragraph regarding patient's neurology department stay. Okay, now on 19th October, Mrs. James was transferred to neurology ward where she had developed a urinary tract infection for which antibiotics were initiated. When you check this particular sentence, you can find 2 tenses. One is past perfect tense and the other one is simple past tense. So whenever we talk about something that happened, 2 events that happened in the past, in order to denote the first event, we use past perfect tense, and the second event, we use simple past tense. So that is what I have used in this particular sentence. Now coming to the next sentence, warfarin was also commenced for 5 days after her lab reports had indicated positive APLA and protein C deficiency. So now we have written about patients presenting complaints, investigations, physical examination, and the treatment provided in a very concise manner. Now we need to talk about patient's present status and the medications that the patient is to be on after the discharge. Here we have more than 5 medications. So in such case, we don't need to write all the medications into our letter, but to be on the safer side, you can just mention it in a very concise manner, just like this. Currently, Mrs. James is making good progress and will be discharged to home on medications, details of which are attached with this letter. So this is how we can end the current status of the patient. Now coming to the conclusion. Here you are writing to a GP. So whenever you write to a GP, you cannot ask the GP directly to do all the tasks that we find in the discharge plan. You can write to the GP if the GP needs to do any further assessment or treatment. That can be directly requested to the GP. If it is for any further observation or nursing management, you can provide this information as information, not as a request. Okay, so you can just write it this way. Following discharge, Mrs. James will require to be monitored for any loss of consciousness, blurred vision, facial deviation, slurred speech, limb weakness, as well as for medication compliance. Please note, she needs to refrain from driving and strenuous activities for 1 month and has a review after 5 days in neurology OPD with PTINR, URE, and urine culture and sensitivity. So you can just conclude the sentence with one more sentence. Thank you for being involved in Miss James' follow-up care. So the next line is the cliche. Should you have any further queries, please do not hesitate to contact me. Yours sincerely, Charge Nurse. So that's it. If you found this video worth watching, please like, share, and subscribe to our channel. Thank you so much.